Greetings and welcome to this presentation on the origins and evolution of clinical documentation integrity, commonly referred to as CDI. Over the next 15 or 20 minutes, we will delve into various aspects of CDI, exploring its significance in today's healthcare landscape, its historical development, and the technological and regulatory factors that have shaped its evolution. CDI is crucial for ensuring that medical documentation accurately reflects the clinical status and treatment of patients, facilitating improved patient outcomes, enhancing billing accuracy, and ensuring compliance with health regulations. So first of all, let me introduce myself. My name is Toni Appleberg Parks, and I am a clinical documentation integrity specialist and educator, health administrator, revenue cycle specialist from the United States, and I'm so happy to be here with you today. Okay, this session will provide a comprehensive overview designed specifically for physicians and aims to deliver clear and practical insights into the field of CDI. So let's get started. First, just a short disclaimer. This presentation is for educational purposes only. The information provided is accurate and authoritative to the best of the author's knowledge and this instructor concerning the subject matter covered. It is offered with the understanding that the presenter is not engaged in or rendering legal, accounting, or other professional services. If expert assistance is required, the service of a competent professional should be sought. Additionally, this presentation includes proprietary information belonging to innovation consultancies. Permission is needed from innovation consultancies to use any of the content displayed here. Clinical documentation integrity, or CDI, is a critical aspect of healthcare that ensures the accuracy and completeness of patient health records. At its core, CDI involves a systematic process of reviewing and improving clinical documentation to ensure that it accurately reflects the patient's clinical status. This is crucial for several reasons. It supports high-quality patient care, enables accurate coding and billing, and ensures compliance with health regulations. Today, we will explore the fundamental principles of CDI, its importance in modern healthcare, and the skills required to implement effective CDI practices. Today's healthcare landscape demands not only the accurate diagnosis and treatment of patients, but also meticulous documentation that supports these activities. CDI plays a pivotal role in this process by ensuring that the health records of patients accurately reflect their clinical status and treatment. We will cover how CDI is applied in practice to enhance patient care, ensure accurate coding and billing, and support clinical decision-making. The documentation standards in healthcare have evolved significantly from simple handwritten notes to sophisticated electronic health records. As someone who was around during the time of handwritten records, I can attest to the fact that auditing and following up or doing any kind of work with those charts presented a significant challenge, and although there are challenges associated with the electronic version, it definitely has made that process a little easier and clearer. This evolution has been driven by technological advancements, regulatory changes, and the growing complexity of healthcare delivery. Today, we will examine how these changes have influenced the development of documentation standards and the role of CDI in promoting accuracy, completeness, and interoperability of health records. The historical perspective of CDI reflects a shift from primarily financially driven initiative to a quality and compliance focused practice. Keeping in mind that this originated in the United States, so the history of CDI revolves around those regulations, managed care, and healthcare landscape that exists in the U.S. and may be different in your country. However, since it is the history and how it has evolved, we will discuss some of those things in a high-level brief overview. So initially centered on securing appropriate reimbursement, CDI has expanded to encompass a broader scope that includes ensuring the quality of clinical care and compliance with healthcare regulations. We will trace the evolution of CDI, highlighting key developments in how they have integrated CDI into healthcare practices in the coming moments. So starting with the introduction of diagnosis-related groups, or DRGs, looking at the background, DRGs were introduced in the early 1980s as part of the U.S. government's effort to control healthcare costs. This system classifies hospital cases into groups that are expected to have similar hospital resource use. And this had an impact on CDI. DRGs shifted the focus of medical billing from a fee-for-service model, where services are billed separately, to a case-based system that encourages efficiency and cost control. For CDI, this meant a heightened need to ensure the accuracy and completeness of medical records to correctly classify cases into the appropriate DRG. So how was this implemented? With the implementation of ICD-10. ICD-10, the 10th revision of the International Classification of Diseases, was implemented in the United States in October 2015. So this is our diagnosis codebook. There are two versions. There's the ICD-10-CM, and that is typically used for outpatient coding, and the ICD-10-PCS, which is usually used for inpatient coding. It expanded the number of coding categories and allowed for more specific and accurate representation of diagnoses and procedures. It had a large impact on CDI. The transition to ICD-10 significantly increased the granularity of coding, thereby requiring more detailed documentation. CDI programs had to adapt to ensure that the documentation supported the detailed codes, enhancing the specificity and accuracy of medical records. Then there was the transition to value-based care models. Value-based care models, such as those promoted by the Affordable Care Act in the U.S., focus on the quality rather than the quantity of care provided. So that is the direction that healthcare has taken. These models aim to reward healthcare providers for the efficiency and outcomes of care rather than the volume of services. Further impact on CDI: with the transition to value-based care, CDI's role expanded beyond ensuring accurate reimbursement to supporting quality measures. Accurate documentation became crucial for demonstrating compliance with quality standards and achieving better patient outcomes. And so just to expand on the CDI impact and a discussion of enhanced accuracy, I guess. Each of these milestones has emphasized the importance of accurate documentation as payment and compliance increasingly rely on the exact details recorded in the patient's chart. Further impact is in financial alignment. By aligning documentation practices with financial incentives, healthcare organizations can ensure that they are not only compliant with regulations, but also financially sustainable. And then also impacted is quality of care. Accurate and comprehensive documentation supports high-quality patient care by ensuring that all patient interactions and treatment decisions are fully recorded and reflected in their health records. So these milestones underscore the evolving complexity and increased importance of CDI in navigating the financial, regulatory, and clinical landscapes of modern healthcare. Okay. As we conclude, once again, I'd like to thank you for your time and attention today on this discussion on the origins and pivotal developments of clinical documentation integrity. I hope you've gained valuable insights into how CDI has evolved to meet the challenges of modern healthcare systems and the critical role it plays in ensuring accuracy, compliance, and efficiency of healthcare documentation. We've explored the introduction of DRGs, diagnosis-related groups, the transition to ICD-10 coding, and the shift towards value-based care models. Each of these milestones has significantly shaped the practice of CDI. These developments highlight the importance of precise and comprehensive clinical documentation, not only for the sake of regulatory compliance and financial stability, but also for enhancing patient care outcomes. If you have any questions about the topics we've covered today, or if you'd like further information on how to effectively implement your CDI practices within your organization, please do not hesitate to reach out to innovation consultancies. And if you have any specific questions about this and other CDI topics, you are welcome to reach out to myself at the email on the slide. Let's see. So I'm readily available to assist you wherever I can. It's been a pleasure discussing the dynamic field of CDI with you, and I encourage you to stay engaged and proactive in leveraging the insights and strategies shared today to enhance your CDI processes as we continue forward with additional modules in this series. Thank you.